Hello, once again, this is Gugulatu Manana. I speak about art therapy and its useful way of healing different conditions that people find. So today I'm going to be speaking about how we can use art therapy to heal, the loss of a child, your stillborn child. So I wanted to say it is a difficult experience, but I just wanted to speak some more on it. So, what I have for you is just to introduce the topic, the benefits of art therapy for stillborn parents, how art therapy works, and give you some examples for techniques that we could be used with stillborn parents, and the role of an art therapist in the matter, and just some closing thoughts. So, having a stillborn child is a very traumatic experience for parents who have lost their child before birth. The grief and pain can be overwhelming, and also what we found is traditional forms of therapy may not be always effective because the pain is so deep and so personal. So it is tough. So how I just wanted to expand some more on this. That when it comes to art therapy, there are many different types of art that can be used: drawing, painting, sculpture, photography are some of the options available. And each of these, there's many more. It's just that these are the ones that I could think of for now. Each of these can be used to explore feelings and emotion related to the loss of a child, because it provides a way to express the pain and sorrow that comes with the loss. And the art created through art therapy can be used to create a memorial or tribute to the lost child. This can be done through creating a painting or sculpture that symbolizes the child, or creating a photo album of the child. It can be a way to honor the life of the child and keep the memory alive. So when it comes to the process of healing, this is where art therapy can be powerful, as it can provide a way to express emotion that come with the loss of a child. And it can also be used to help create a sense of peace and acceptance. It can provide a way to process the grief and can be a way to move forward in a healthy way. So how art therapy can be used also for those who are grieving in other ways. It can help them to process the emotions related to the loss of a loved one, or to help with the healing process of any kind of trauma. Really, it can also be used to help issues such as anxiety, depression, and post-traumatic stress disorder, depending on under this what circumstances the child was lost. It is one of the most powerful tools. We found it for grieving, and because it's sometimes when words are not, or they are overwhelming to speak, or you cannot put words into a thought or a feeling. So this is where art therapy, it can help to express your emotion, thoughts, and feeling, and it can be an important part of the healing process, as it can be used to create a tribute or memorial, and just for the procession, and provide a way to move forward um, for the parents and those involved. So the benefits of art therapy, as I mentioned, it's just to provide the space for the parents to express their emotions without judgment. We don't know under what condition, but through the creation of art, the parents can explore and process their grief in a way that feels natural for them, and in the time frame they want as well. It's because art therapy also helps to reduce the feelings of isolation and loneliness, and it can provide an opportunity for parents to connect with others who have experienced similar losses, and to feel supported by a community of people who understand what they are going through. So this is where group therapy is useful, and support group function with this role. So how it works, it engages the creative process to express emotion, and also I think the process of art itself is part of the therapy for the client as they are create. It doesn't have to be in one sitting. I mean, it can be a creation extended over how many weeks, as much as they, each time there's progression, whether even forward or, the client is able to go back in time or and release pent-up emotion and express themselves in a non-verbal way, so the art therapists, you work with them and you identify themes and patterns, and it helps uncover underlying emotions and experiences which they may not have been aware of. And through this, work with the client, they can process and they can gain insight into their feelings and develop coping strategies to manage their grief. I just wanted to share some examples of our therapy techniques with stillborn parents, for stillborn parents rather, is the creation of memory box. So this is technique is most useful as well to anybody really that has experienced some form of loss, in whether death or loss of any kind, which can be equated at time to death, some form of death in a particular area of a person. So this box may contain mementos, keepsakes that represent the baby and the parent's relationship with the child. And this can be a cathartic experience, because the parent is honoring the child's memory, and it is their connection to the baby, their hopes, their dreams. And another technique is to use of guided imagery. The therapist would guide the client through a exercise where they are asked to just have a look and imagine and visualize and express their emotions, and this can be useful, very helpful for clients who have difficulty expressing themselves verbally, because all they need to say is just to use their imagination of what is happening. And so the role of a therapist in this environment is, first of all, to create a safe and supportive space, and help the clients to identify and develop a treatment plan that meets their individual needs. Obviously, with grieving and loss, it depends, but at each stage, there will be some form of one step at a time type of situation. And as therapists are trained to recognize and respond to emotional needs of their clients, we provide guidance and support throughout the art making process. So whether through directive processes or non-directive processes, or whatever, the client's free association. So the clients, they develop coping skill to manage their grief outside of therapy sessions. That doesn't mean it's homework, but because the overall goal of um, us meeting with our clients and helping them through the work is to be able to build internal resources that they can draw from, in all, to for their growth and for their healing and for coping and management of emotion in this instance. So yeah, what we found, just some thoughts, what I said before is, it is a tool that people find, and it's useful that people really find meaning, because you would have the art to refer to. I mean, it could be a work in progress, and when you are ready to move on, finish it off, do it bit by bit, and art therapy is a unique approach to grief counseling. It's another tool or towards healing and recovery in connection with others who have similar experiences and losses. So this is what I wanted to share with you today regarding parents and people who've lost their children, in this case stillborn. Until next time, Join me in my channel, The Art and Wellness. I beg your pardon, the art and culture of wellness. Until I speak about art therapy. Until I see you next time. Bye bye.